Hey team, welcome back to another class. This time we're talking about cardiovascular theory in term 3. Now, I know for your group, you haven't had much of a break, so I know we're going straight into from, I think, behavioral now, going into cardiology. And I just want to let you know this week in cardiology is going to be a little bit of a breath. I mean, we're not on break this week for cardiology for sure, but my intent in this week is that we're covering some concepts that you have some basic knowledge of, and we'll tie together the resources that you've worked on before in your paramedic training, some of that with me, and how we're going to use that in this class. And we'll talk a little bit about lab too. So there's a few things that I owe you this week that I'll send out. I'll cover some of those towards the end of this and remind you. But one of the big things that I will send out to you this week will be as I like to in my class, the list of things that you need to get done as assignments and due dates. I'll send you that single page out, and we'll kind of look at how the schedule will play out for the rest of the term. So as you look through this week, hopefully you're putting some pieces together, you're setting up what your study schedule is going to be, you're inputting dates into your personal calendar, and you're basically getting ready for the hard work that will start, I think, in my opinion, next week. This week is certainly going to be some work. For some of you, it may be more difficult than others, but again, a lot of it's going to be a review. If you have any questions this week, you're welcome to email me. Let me know when you would like to meet. We can sit down for some office hours. This semester, I've got a couple different changes to my schedule. So really Mondays and Wednesdays will be my most flexible days, but if you need to meet on other days, please let me know. I'll show you my office hours as they're scheduled in the book, but again, if you can't make those, especially for fast track students, just give me a shout and we'll see if we can spend some time together, even just by Zoom. All right, well, let's dive in. So here's the course shell. Our course shells are a little bit different this term. Some of them have been updated, not all of them yet, but some of the theory shells have been updated to a format that you'll see will be similar across classes. So I'll cover some of that here because it may be one of the first classes that you've seen. Forgive me though if I cover some concepts you already know. I would like you to watch this video in entirety, even if some of these small details you've seen in other classes because of our new formatting, because there will be some important points along the way that'll help you with this class. All right, so no major changes here on your first page when you land in. We've got a schedule of topics, we've got our due dates and so on, and I'll update these things to you in that other document as mentioned. When you come to the course, and right now we're looking at as it should look to you in your view and not as instructor views. When you first come to the course, I'd like you to, even if you've seen it in other classes, just spend some time going through the overview and syllabus section. Here we've updated so that the format will be the same, but every class will have different information in this section, but follow the same format. Make sure you review the course competencies. The course competencies are essentially what we need to make sure we've trained you with before certifying you to move on to the next block of information in alignment with our accreditation and preparing you for national registry. The learning objectives here are going to be learning objectives that the entire course will play into. And you'll notice that as you go through the different modules, which I'll show you in a moment, each module will have module learning objectives as well. As I'll describe in more detail in a moment, as part of the cardiovascular course, you'll be taking ACLS through American Heart Association course certification. These are the specific ACLS course objectives, and similar to the way that we did this in trauma, where you took PHTLS last semester, you have some requirements for ACLS, like we did have requirements in trauma for PHTLS, and you have to do those, but they're embedded, all the content is embedded in our lectures, embedded in our course already. It's just that we have certain things that we have to do to meet the requirements of ACLS certification. At the end of this course and completing the requirements in lab, you'll receive a 2-year certification for advanced cardiovascular life support, which is a requirement for licensing in the state of New Mexico and in most states as a paramedic. And then here we've got the syllabus. I haven't made any major changes since I sent the syllabus out last week, I believe, to you, but make sure you've got it, you have it handy, and you review it. There's some changes to the attendance policy, so make sure to review those. Otherwise, it'll outline some important key details about our course, our assignments, and so on, and I'll go over that in just a minute. All right, after you've gone through this, make sure you start there. You're going to want to make your way down to Get Started Here. Now, every new course that we've designed has a Get Started Here module. They are very similarly formatted, but they have different information than, again. Once you land here, you'll find the Get Started page. I'll visit in just a second by clicking this. Here's a map. You can look at this map if you'd like to, but there's no requirement for you to do so. This map shows where all of the different learning objectives tie together for modules, sections, and even shows which assignments are covering which learning objectives. So if you're trying to figure out where information is in the course, this document is available to you, though not necessarily a requirement, and we won't be testing on that information. Finally, for our online class, we'll be posting in the introduction section. There's not a lot of discussions that we have for this course this term, especially because you have an interactive lab that you physically have to attend. But we do have this introduction that you'll get started on, so take a moment to dive in, follow the instructions on your posting, and get that done within the first week. All right, let's look at the Get Started page for our cardiac class. All right, so again, we revamped many of our courses the last couple terms. It's been over a year in the making, and I think we've got a really good format for you that should make it easier for you to navigate our classes. Now, this course was built technically recently by Joy Cherry, and Joy Cherry and I collaborated on it. She did a great job in building the course. She made this orientation video, and it's got some information that'll help you. I won't cover now. Very brief video, but take a moment to review that. The reason she's presenting is just because she's the one that facilitated designing the course. I was assigned a different course to handle, but it's the same information nonetheless. All right. Now the navigation section, I'll let you view on your own, but it helps you kind of figure out where things are in the course. I want to focus more on major assignments and course information. Here you can find information about the major assignments with links to find each of these components as you need to, and it has the same information that's in the syllabus about grading and what chapters are covered. So a really useful thing, especially maybe later when you're getting ready for exam one. It's been a couple weeks since you looked at the syllabus. You can come here and find quick information and links to just look at something before you take the exam, for example. You'll find the same thing for quizzes. All of our quizzes, including the syllabus quiz, our assignments, and the Huff book, which is also a set of assignments as well. And you can find these links should take you to the areas where you'll be submitting all of those assignments. Now they're buried in the module, so preferably you'll find them when you go through each step of a module. But again, quickly you can find them here. If you need to, right before an assignment due, you just got to find it, submit it, a great resource for you. In the course information section, we've got some standard information and then some course-specific information. These two sections will take you to the syllabus. Course expectations, please review. The grading and feedback is just basically restating some of the grading components that we need to be aware of from the syllabus. Now, I'll review them in the syllabus in just a minute, so you have orientation to it. But again, if you need to quickly figure out what the grading and feedback's like, you can find that here. And then some more information on attendance, learner support, and other resources that CNM has provided you. So take a few minutes this first week to just go through, make sure you know where these things are. No need to necessarily memorize them as long as you know where to find them later. All right, excellent. Let's get started. And again, make sure you post the discussion section just briefly and respond to 2 other students. Sometimes you'll find, especially in the fast track class, that you maybe haven't interacted in lab because of the days of your lab and the days of another student. So you might be able to interact with someone you haven't seen in lab before through this measure. All right, next make your way through to the weekly schedule. I will, as mentioned, post the list of all just the due dates, right, for each assignment, that 1-page sheet I'll give you. I'll post that here, but this has actually our class schedule and reading outline for you. So here you won't necessarily find exactly which page numbers that you want to review. You'll find those in each module, but it shows the flow of the class that we'll be covering. This should basically mimic the modules that you see in the table of contents, but if you prefer to have a written schedule, you have this. But again, those should align pretty well with what we've published in the table of contents. All right, so again, I'll let you review these, just showing you where some of these things are. Okay, now again, before we start the course content, like actually working on graded material, I do want you to spend some time in the foundational knowledge review and review from previous classes section. Now this will be a helpful area. None of the things that are in this are going to be graded from this module, but they will help you in other areas of the class. So let's review what it is I'd like you to do with this information before we get started on our first modules. Make sure you reviewed the New Mexico Scope of Practice. The document hasn't changed recently since we last last talked for, say, pharm and trauma, but make sure that you have it handy. Again, the scope of practice only outlines the things that we can do, not how to do them and with which means necessarily. So, for example, in some areas it's very specific and it says a paramedic can use this precise tool. In other areas it says a paramedic can use vasopressors and leaves the whole class of vasopressors open to us. Understanding your scope is going to be very helpful for you this term, especially when you're going to clinicals, because we want to make sure that you're working within your scope and the requirements of your clinical host, like UNM has certain requirements and meds that can be given versus Presbyterian. So always have handy the New Mexico scope of practice. In this section under Kathy's pharmacology videos, these are basically the same videos that you saw in the pharmacology class last term, and not all of them, only the ones that really are specific to the cardiac class. Make sure you review these, but you may not necessarily need to review them all right now and seek to memorize. Most of it will be a review, hopeful, but you'll find, say, later when we talk about CHF, you may want to come back here and look at heart failure medications, for example. So these resources are the videos previously. You see we've got ANS here, which is a big component of cardiac care, as we mentioned before. We've got diuretics, we've got antihypertensive, and antidysrhythmics. Now, in these videos, remember, since they're from pharmacology, they will not include drug dosages. But this semester, different from pharmacology, we do require you to memorize the drug dosages for the drugs that you'll be using in your scope of practice. So you'll have to add that information to the drugs that you're seeing here. We'll cover drugs to a lesser degree as we talk about their use in every module in the future. So for example, when we cover atrial rhythms, we'll be talking about the drugs, again, that are utilized to manage atrial dysrhythmias. But we won't cover the same depth and detail of those because we've done that already in the pharmacology class. So when you're going through each module, you can pair up the drugs that you need to work on and start memorizing your dosages then. However, if you're somebody that just kind of struggles memorizing drug dosages, it takes you a long time, I'd recommend you start doing that now to just get a step ahead, get a little extra time memorizing the dosages so that when you need them in lab, when you need them in theory, they're already there for you. Again, especially for those that kind of take a little bit extra time with just straight memorization. All right, so these resources are here for you to review. And then finally, we've got a section on math. Now, in this class, we will be doing calculations. Many of the drugs that we give in cardiology require continuous infusion, require weight-based calculations, and none of that necessarily should be new to you. We started that at the beginning of term 1 with the drug calculations class. These resources here are a good reminder, a good refresher for you so that you can prepare for exams and quizzes, and certainly this will help you for lab as well. These aren't going to be submitted in class. They're not homework for you to turn in, but they are practice documents that I'd like you to work on before taking your exams, before taking your quizzes. So if you want to do that now to get it out of the way, to make sure you know what you are successful at and what you need to study, that would certainly be fine too. But at least before we get to those modules where we're giving these drugs with continuous infusion, make sure you've reviewed it. The first document here, continuous infusion standard concentrations and mixtures, is basically just a reference document that you can use. Now, a caution, continuous infusion standard concentrations are not universally standard. So these are what we find most commonly when we're in the field that our departments are ordering us to have on the rig. But remember that you may memorize, say, the concentration of X drug is this from the sheet, but you always do need to check because with drug shortages and different manufacturers, these standard concentrations may not be what you actually have in your hand in the truck. So these will be helpful to kind of orient yourself, but always check the drug bag to make sure you have the right thing to base your decisions on in a scenario and in the field. But again, makes it very helpful for you to kind of expect what you'll be grabbing out of the box in most cases. These two documents that follow, continuous infusion practice and the key, are basically the same document, just the second version is the key. The continuous infusion practice document has a number of questions over a few pages that will have you calculate the most common cardiac drugs for continuous infusion and a few others that will be helpful. Make sure that you can do that math. It would be unusual, I think, if this was something you hadn't seen before. But if you're struggling with math and struggling to get through this packet, schedule some office hours with me or with your lab or even with our advanced supplemental skills class, if you're scheduled for that, to spend some time working on math. Although we've covered a lot of math up to this point, we still something we need to practice. So I'm happy to meet with you and spend some time. I'm just not introducing it for the first time here because we've done that in our previous work. All right, so for this module, it doesn't even have a module number, but it's called Foundational Knowledge and Review from Previous Paramedic Courses. Make sure this first week that you spend a little bit of time getting to know these resources and put a game plan to yourself of when you want to cover them. Make sure you've covered them before you need the information later in the term, but I'll let you figure out how you plug that into your personal studying plan. If you have any questions about those docs, let me know. The last non-module module that we have, like our warm-up module, is a module that covers the cardiac treatment guidelines. The cardiac treatment guidelines are a great resource, and I think that compared to other terms, you'll find them very, very helpful to you in this semester. So in this module, we have a couple things for you to review. The first is a quick video that I made that kind of talks a little bit about the cardiac treatment guidelines. The second is the order to learn cardiac treatment guidelines in, and I sent this and the actual guidelines to you by email before the term started. Now, let me talk about this order to learn cardiac treatment guidelines very quickly before we move too much further on. The reason this document exists is because of a few different reasons. So let me diverge a little bit and discuss lab and theory as they pertain to the guidelines. So for our cardiac treatment guidelines, the goal is that you have one place that you can find the information you need to treat patients in cardiovascular emergencies. And you don't have to look, as we have in other terms, through all the different state guidelines, the textbooks, and all of these different areas. Because these things are predominantly, the guidelines that we use in the field for cardiovascular care are predominantly sourced when new updates from the American Heart Association come out from the Advanced Cardiovascular Life Support course and all the science that goes into it. We basically provide one document that incorporates all of those recent changes. And this is important because you'll see in the syllabus in a moment that we need to have the ACLS student manual as one of our books, but we also have the paramedic textbook. The paramedic textbook takes time to put together and was printed before some of these final changes in ACLS were made. And so there may be instances in when you find in the paramedic textbook, although pretty new, doesn't have the most current information that we would be using in the field. So the cardiac treatment guidelines basically becomes the area that you go to determine what your treatment and to memorize and use in theory and in lab, and does a very good job of preparing you for the field. I wouldn't anticipate there will be big changes to cardiac treatment in the AHA world for another few years. So your first few years working in the field, your protocols will be very, very similar to the guidelines that you see here. Having the guidelines for both theory and lab is helpful, but as you've seen in other EMS classes, because our labs cover multiple theory topics at once, I think this term you'll have respiratory, behavioral, and obviously cardiac. So we have to cover all of those topics in one lab, which means that when we cover something in cardiac, we may not be perfectly in sync with when that's covered in the lab class. So this document here is to help you basically prepare for lab and somewhat follows the outline of the things that we're doing in theory. The document itself, the cardiac treatment guidelines document, is organized more or less like alphabetized organization of the different diseases and disorders that we're treating. That's not necessarily exactly how we cover everything in the class. Now, since this is a guide for both theory and lab, for lab, you want to make sure that you're looking at this document and looking at your lab schedule and determining which parts of the cardiac treatment guidelines to start memorizing even before we've covered them in theory. As you'll find, some of the first skills that we work on in lab will be associated with bradycardia, for example, something like pacing. Now, you don't necessarily have to have all of the background knowledge of managing a patient that's in bradycardia to understand how to use a pacer on a machine, right? But it does help for you to have some context. So this is helpful for you to say, okay, this week in lab, although in theory we're a few weeks away from looking at bradycardia, this week in lab we're going to be working with the monitors on pacing. You do need to come back and review from the cardiac treatment guidelines symptomatic bradycardia, because that's where we have listed how and when to use the pacer in those situations. That will give you the context so that when you're learning this skill in lab, you've got a little bit more information and one very easy place for you to go to, and it's just straight memorization at that point, so that you're able to get a lot out of lab, even though we haven't covered those things in theory. So this is the order, not the order of the cardiac treatment guidelines that I'd like you to kind of go through and see from table of contents. This is the order that you need to start memorizing. And I would start memorizing things like symptomatic bradycardia, sinus tach, and PEA early this week if you can. It does include drugs in it. It includes drug dosages and so on. What's absent, though, is all the background information on how these drugs work. And that's where you'll have your pharmacology resources and your textbook to help fill in the dots, and certainly the topics that we cover in class. All right, so that's why this document exists and is a little different than the actual order of cardiac treatment guidelines. This will be up to you, though, to manage when you're preparing for lab. You can't just show up to lab and hope to get everything out of it by them presenting it to you for the first time when you show up. You've got to do some work beforehand. This helps you get that work done in the right order. Okay, so that's the actual order to learn them in. So try and start working on that a bit this week. And then here's our guidelines. The guidelines themselves cover not just dysrhythmia, so this is not an EKG class. The EKG class is a part of this, but this covers pathophysiology, treatment, management of all cardiovascular and even some non-cardiovascular concerns for us. So this is pretty comprehensive. Have this available to you at all times. So if you're somebody who likes paper, make sure you bring to your lab class this paper document, or PDF would be fine. If you're coming to a theory course, you're coming to office hours, have this available. When you're studying cardiology, have this available. This becomes like the primary source for you to review to learn how to treat and translate the theory into our lab class. And again, when we have theory questions on an exam that are scenario-based, these will be the guidelines you'll use to prepare for those exams and where the right answers and key answers come from. All right, we'll be going through these as we work on every module as well in theory, so I'm not going to cover them entirely now, so just kind of introduction. But make sure you have that, you've taken a look at it, and you start memorizing them in the order that's outlined. Okay, so again, this is a resource, so there's no test for this component or this submodule. These are resources you'll be testing on later. Then we come to Module 1. So in this first week, we need to work on our Modules 1 through 3 to kind of get the background information we need to then get into paramedic level cardiology very soon. Okay, before we talk about the whole content here, because it's pretty straightforward, this is just the syllabus, let's look at the layout here. So this is how our modules that have graded content, course content, will look as we progress. In each module description, you'll see a little bit of a description of what you can find here. Again, this is just for the syllabus, so there would be course competencies listed here. These are only the course competencies that this module covers from the overview and syllabus page. And then the module learning objectives are the learning objectives that you're completing while you work on this module to prepare you to pass the course competency. There's also a brief agenda for you to look at, but more importantly than that, the next step is to go to the checklist. Why don't we look at the checklist for Module 2 in a moment, because it'll have a little bit more in it for you to use. But in every of these numbered modules, every other module with content in it, you'll find a checklist, and the checklist helps you kind of orient yourself and make sure that you have an idea before you start the module of what you need to get done so you can game out your studying. But it's also a checklist for you to literally check off and make sure you got all of these things done before you move on and say, I'm done with this module. That way you don't miss anything, you know what stuff's important, you know what stuff is optional. All of that should be clear to you. So start with a checklist and come back and refer to. In fact, come in and click off, like click I did this thing after you've done it, so that your checklist shows 100% and you know that you're done. All right, again, we'll look at the checklist for the next module because this literally just says look at the syllabus and take the syllabus quiz. During the first week of class, make sure we've done our syllabus acknowledgement statement, very brief quiz for you to make sure that you've acknowledged you review the syllabus and you'll abide by the syllabus's policies. And then Module 1 is essentially done and you can move on. Also, keep an eye out on this progress bar. The progress bar can be very helpful. Sometimes, though, this progress bar might include things that are optional, whereas the module checklist progress bar that you'll be working on has a very clear delineation. So you may end up in a module where something might be optional and it shows 10 things in that module and you got 9 of them done because one of them was optional and you decided you didn't have time to do that. That's fine. This wouldn't show 100%, but your checklist should show 100% because you've said I've at least looked at it and said I didn't need to do anything with it. Hopefully that makes sense. Let's look at Module 2 because this has actual some content we'll be using, and the checklist will be a better representation here of what you'll see in future modules. In this module, again, we find the description. This is called Module 2, the ACLS warm-up. This is going to be kind of brief, just an orientation to what ACLS is as a component of this class, and then a few things that we need to get done in this components. So module learning objectives here, we want to demonstrate proficiency in doing these things. You'll find that ACLS incorporates BLS, of which you recently got recertified from your last term lab for the paramedic lab 1, which was where we did trauma. You did a BLS course there. So it should be pretty fresh to you on the BLS side of things, and hopefully we're only adding the ACLS stuff to you. Let's look at this checklist here. So again, this is representative of the checklist you'll see in other areas. Notice that there is its own kind of area of progress, and each of these areas is something you can click on once you've got it done. So start here for every module, look at what you need to get done, and then put your game plan together, and then go back to the module and work through these components. Once you, for example, review the AHA BLS textbook to prepare for the AHA BLS review quiz, just come and click this off, and it will show that this is complete. So for Module 2, you're going to review the AHA BLS textbook as needed. Again, it should be pretty fresh to you, but you want to make sure you know how to do good CPR, what are components of high-quality CPR, how to use an AED, all the BLS stuff that came with the CPR class. You'll need to make sure you know. Those questions will be on your ACLS exam at the end of the term as well. So that's why we're bringing it up. It's not just ACLS, it'll include BLS. You have a BLS quiz that you'll take in this module. It is graded, goes into your gradebook. You have 5 attempts to complete it. Generally, you probably will find after taking the first attempt, you'll know what you need to work on, and you can probably power through it pretty quickly. And then the last component is to do the ACLS pre-assessment, and you'll upload this document as an assignment to complete the module. All right, let's go back to the module and look at these components to go with our checklist. All right, so here's our checklist. Here's a quick video about ACLS that I've made for you so you can kind of get a feel for what ACLS is. Here's the ACLS BLS review guidelines quiz. So use this in conjunction with your your AHA BLS book that you had for your CPR course. Here's a link that you'll go to. Follow these instructions. This is kind of like our pre-test that we had to complete for PHTLS. It's similar, but it's through a third party. So you're going to go to the AHA website, take this self-assessment, and then at the end of it, you'll get a PDF document that says you completed it or a screen capture that you completed it. You'll bring that back and upload it here to this assignment to complete Module 2. Okay, good. So now you've done some of the basic things you need to do for the ACLS class to get kind of warmed up. You've looked at a few resources, and the ACLS warm-up is a pretty good preview of what's to come in ACLS course as well. All right, after Module 2, you'll want to move on to Module 3 for this first week and start working on the content. Now again, Module 3 is not necessarily a warm-up. It's content. You may have to spend some time working on it, but a lot of this will be review. So we'll be putting pieces together here from even as far back as your EMT basic course, the basic level orientation to cardiovascular AMP is a great starting place. So we build upon that, but we'll also be referencing concepts that we taught in human systems a couple classes ago. Now, in this, again, we've got our outline for what we're looking forward to in this section and module. We've got our course competencies, our model learning objectives, and we have an agenda. Now, this is where you find the assigned reading that you can work on for the module, and this is kind of to comprise all of the resources that you have together. In most of the future modules, when you see Huff workbook, you're going to be actually completing the workbook and the EKGs that are in it, but here it's just a reading assignment for that. We won't start working on EKGs for a couple modules, but here you do have some reading on the background of cardiac AMP. The paramedic textbook is a great resource if you'd like to look at it. You could always go back and look at the human systems textbook as well. But generally at this level, you've got that behind you. You're going to be refreshing certain components that you individually need to refresh. So the paramedic book is a great resource. You also have the ACLS provider manual that can give you some background and some resources we've provided for you. Now this will be a good representation of the flow of most modules. We have our checklist. We have a document that you can work through on heart anatomy. There's the key for that document, so make sure, again, with classes like this, you want to memorize these documents. Even though you won't be uploading this or it's not a quiz, you have the key provided for you to check your own work. Make sure you memorize this information because these things will be on the exams and the quizzes. We got a brief video that will follow blood flow through the heart, and this should be very reminiscent of EMT Basic when we asked you to follow a red blood cell through the body and what structures would it come into contact with, right? Like it would come from the vena cava and go into the right atrium, and then it would go through this. So that's essentially what we'd like you to brush off. You'll need that information. Also, coronary artery circulation is extremely important. So as part of the anatomy and physiology of the heart, we need to make sure we know the structures of the heart and how the heart works, how blood flows through the heart, and then you do need to work on memorizing coronary arteries and their circulation. Now, coronary veins are important in cardiac AMP, but we generally don't do a lot with them. So we're going to focus mostly on coronary arteries. Just very briefly, let me tell you why this is important, kind of give you where you're going to connect these pieces. As a paramedic, having graduated, when you're in the field and you run on a call, and let's use a heart attack as an example. There's many cardiac things we're going to cover. Let's use a heart attack as an example. When you place the 12-lead ECG cardiac monitor, LifePak 12, Philips, whatever it is, when you place it on your patient and you do a 12-lead EKG, it gives you 12 pictures of the heart. And they were all taken from different views, different vantage points. It's like having 12 different cameras strategically around the heart as a 3D structure. When we look at that piece of information, and it's only a small piece of information, it doesn't tell you everything you need. You have to put all these pieces together. When you look at that EKG and piece of information, what you're getting from it is everything working normally in that area? And if something isn't, you then trace to what part of the heart it's looking at from your knowledge of anatomy and what the EKG is doing. And then you're going to be able to determine what is the physiologic, or in this pathophysiologic consequence of having this injury in that location. So let's use an example. When you get to that point on a patient's call in a house, they're very sick, you're doing a 12 lead, you try to determine where their heart attack is, so it dictates the rest of your care. When you take that 12 lead picture, you need to be able to then say this lead, let's say lead 2 is showing me this information. You need to be in your mind from this AMP section, your background knowledge memorized so you can access it on a call, be able to say lead 2 looks at this part of the heart. And this coronary artery is what feeds this part of the heart. So if I find that in lead 2 there's a blockage causing this heart attack, if that's where it is in this patient, I should be able to determine exactly which coronary artery this EKG is showing me a picture of without looking at a document, without looking at a model of a heart. That's what the goal is of memorization for coronary circulation and coronary blood vessels is at this level. Here you'll be uploading the cardiac assignment, so you'll download the assignment here and then upload, and you do have a quiz that's available on this module. Excellent, so that's the general format for our modules after we get through some of those orientation modules as well. Before I dive into the nuts and bolts of the syllabus, let's look at the flow of the class and get a feel for how these things will be used moving forward. So as you see, the very first week, we're working on orientation to things and then wrapping up with cardiac AMP. As we move into week 2, we're going to be working on cardiac assessment. Now, cardiac assessment will give us some of the nuts and bolts that we're going to need to be able to go and do an assessment in the lab. I'll remind you of these details a little bit later, but the cardiac assessment, I want you to think of as it's a package you're going to get in lab. It's got multiple pages. That cardiac assessment that we're going to give you is very, very thorough and in detail. Now, your goal should be, if I have enough time and resources with my patients, and I think they have a cardiac problem, I'm doing a cardiac workup, I will do this whole sheet. That's your goal, okay? That's where you start. So memorize it as, this is what I should do in every case, time permitting and resources permitting. Realizing that when you get on a call, when you run a scenario, your resources, time, and patient condition may not allow you to do that whole sheet. Maybe you're stuck on one part because that part is what's going to save the patient. You just can't get past that, and then you arrive at the hospital. What I'm saying is you should have the goal of cardiac assessment being very thorough to the full level of what we teach you. And the only reason you shouldn't be able to get that done is because you were busy saving the patient's life in the sub-steps, right? Just back to the EMT basic idea of we want to assess the whole body. But if I assess my patient and there's a problem with A, I can't move on to B until I fix the problem with A. So it's a very similar idea here, though I want to do everything. Module 5 is basically the start of EKGs. So in Module 5, we'll take our knowledge from cardiac A&P, cardiac assessment, and we'll start looking at how ECG monitoring works. Now in this, we're not learning how to necessarily interpret EKGs. We're not learning how to interpret the squiggly lines yet. This is essentially learning the science and background behind how EKGs work. Interestingly enough, I think we're probably all aware that if someone has the right resources, they could easily triangulate your physical location if you have a cell phone on, if we have multiple towers that we can use to try and figure out where that cell phone is pinging, right? Triangulation. You'll find that the concept of how an EKG works in its very fundamental aspects is very similar. It uses a similar process of triangulation. You'll learn something called Einthoven's triangle. Knowing that science is essential. Now, I can't say that when I'm on a call with a patient and I'm looking at EKG, I'm thinking about all these elements in the background. Sure, I'll give you that. But in order to understand how the measurements that we're going to learn about on an EKG are helpful, how the parameters that we use to determine whether someone's EKG is normal or abnormal, to understand those components, you have to understand how the science of an EKG works. And that's the foundation we're giving you. Now, in the beginning phases of EKGs that we look at after Module 5, we'll primarily be looking at 3-lead ECGs. And 3-lead ECGs is to say that we just put the limb leads on the patient. We didn't do the 12-lead by putting leads on their chest. That's a later module. So we'll be learning about EKGs following Module 5 in kind of a standard orientation, get to look at them, look at their dynamics, what do the lines mean, and what does that mean for our patient's condition. And then later in the term, we'll put that into the more comprehensive 12-lead module. Module 6 begins with, let's start looking at how ECGs work, how to interpret ECGs when we're looking at a normal sinus rhythm. So let's look at normal first, get used to it, use the systems that we're going to learn, and then we can go through and start finding abnormalities. Now, a caution here. In Module 6, we're going to start with normal sinus rhythms. So that's generally patients that have normal P waves, they're the right rate. I mean, pretty healthy for the most part, at least as far as the EKG goes. In all the other sections, though, we'll start learning about the pathophysiology that goes with the disorders that we find. So sinus rhythms in Module 7 is to say it starts with the SA node, but it's not normal. It's too fast. It's too slow. So we'll learn the rhythm and the pathophysiology and the treatment as we go through these modules. In Module 6, since we're starting with healthy and we don't have a lot of pathophysiology to go on with it, we're going to introduce to you a couple steps that make up our introduction to basic rhythm interpretation. This is going to be a set of steps that you should use every time you look at an EKG. Using pattern recognition and saying, oh, I see what that is, without any interpretation is just pattern recognition. And you can make mistakes and miss things if you do that. Even if you later pick up an EKG after this class is done and you look at it and you're like, wow, I know what that looks like. I still want you to go through the steps that we introduced here, and you'll use them on every EKG in class, every EKG in lab, and in the future, every EKG that you pick up, you go through these steps to make sure you don't miss anything and you have a comprehensive view and you're not using pattern recognition. Because many things, I'll give you that VTAC looks like VTAC in a lot of cases, right? Especially monomorphic sine wave VTAC. But there are many variables that are not just the pattern that we have to measure and determine to interpret an EKG. So we set that up in Module 6, and then you'll be using that in every module on the way down. All right, so our flow will be essentially to start with normal, how to interpret an EKG. Then we'll look at sinus rhythms, the abnormal forms of sinus rhythms. We'll look at PEA and asystole, atrial rhythms, so rhythms that are in the atria but maybe aren't originating from the sinus node. Junctional rhythms, that's the junction between the atria and the ventricles, kind of think of where the AV node is. And then we'll talk about acute coronary syndrome and CHF as some disorders, move on to LVAD and cardiogenic shock, and look at 12-lead ECGs as we progress through the rest of our content. So we've got a lot to cover here, but that's kind of the orientation to how all of this comes together. Now, as you make your way through every module, scroll it back here a little bit. As you make your way through every module, please make sure that you have available to you these resources, because the videos that are provided for you are succinct. They're Kathy's videos. They're very to the point. You're going to have to use the other resources to fill in the other context that you need to understand comprehensively what's going on with an EKG and the patient's underlying condition. All right, good, lots of information. That's kind of our orientation. Now let's get to some nuts and bolts. I'm going to go ahead and pull up our syllabus here. and let's look at it. All right, so here's our current syllabus for the online course. For this semester, my schedule, let me back up a little bit. My schedule this term has me teaching, because it's a summer term, classes are a little bit longer. On Mondays and Wednesdays are my most flexible days because I have courses on main campus and I have admin time and office hours time throughout the day around those courses. On the other days of the week, I'll be teaching at Rio Rancho campus an EMT basic class that starts at 8 a.m. and finishes at 5:15. And as you know, we just get a short break in between. So Tuesdays, Thursdays, and part of Fridays, I won't be able to meet you during office hours, unfortunately, because of my schedule. However, if we need to find some time, briefly to touch base on those days, I'll do my best to do so. But I am booked all day physically in the classroom on those days. So Mondays and Wednesdays will be better days for me if we're looking at flexibility. Now, of course, with CNM, I do have to put, even though our class is a little different than most classes, you're all working different schedules, you have different labs, you're on different days that you're off and on. I do have to put one set day in the system and in my syllabus that I'm physically available. So that will be Mondays from 1 to 2:30. I will be available for office hours. But again, email me if there's a time outside of that that you'd like to meet by Zoom or in person. Let me know, and I'll do my best to be flexible. I just want you to remember that this isn't the only time I can meet with you. I'm happy to try and meet with you in other times to meet your needs. All right, our required textbooks. So the paramedic textbook will be one resource, and that's the resource you'll be using for the context of pathophysiology, details about anatomy and physiology, and some context about treatment and assessment in your patients. The next book listed is the ECG workout book, and that's basically a workbook. You do need to have this in printed form. Electronic will not work. It'll just make you could do it, but you're going to have a really hard time with grading, unfortunately, and that'll be on your end, unfortunately. So just avoid it and get the physical book. Make sure it's blank, it's not been filled out, it's not used. You can't borrow somebody else's book. Now, the ECG workout for most of our time in the class, aside from the first few modules where we're going to do some reading, most of the workout that you're going to do is by chapter on a set of types of rhythms. And so, for example, when we cover normal sinus rhythms, you'll have a chapter in the ECG workout book that has pages after pages of normal sinus rhythm variations that you're going to interpret. Okay. Now, when we cover a module topic like atrial rhythms, that will be a chapter in your ECG workout book. Now, when you complete these, you're going to be utilizing the steps that we introduced to you in modules 5 and 6 to interpret each EKG and then fill out information under each EKG strip on that workbook. Doing that for each of the strips for that chapter as it's due is what you do to earn the credit. The final step is that you have to submit it. Now, the best way, I think, for your course to submit this is to just take a picture of each page with all of the ECGs done and then upload that for each of those assignments. So what I mean by that is when you're working on, say, the atrial rhythm module in our theory course, you'll be going through the ECG chapter on atrial rhythms, and you'll fill out before the due date all of those rhythms using the interpretation parameters. It's going to ask you what's the PR interval, what's the diagnosis, all these things that you'll have to fill in. Do that for the whole chapter. Then take a picture of each page. Make sure that I can see your writing in the picture, but it doesn't have to be perfect. And then upload those pictures to the assignment in Brightspace. I'll then go in and make sure you did the workbook, and it's really all or none. If you don't fill them all out, you don't get credit. If you fill them all out, you get credit. Now, a catch here is that I'm only checking that you're completing these because it's a workout. You get the benefit of repetition. The other part of that is you have answers in the back of the book for all of these. So to be honest, you have all of that information so you can check yourself. So by the time you turn it in, you already know whether you did it right and you've made the adjustments. And I'm happy to review any specific ones that you have questions about. But it's just about doing this over and over again so you get used to seeing the different variations of, for example, atrial rhythms. Now, a caution on the Huff book. Students in the past who have half-assed the workbook have not generally done well in lab and often failed the class. So the idea here when I say half-ass is they just look at the answers and they fill it in, or they use pattern recognition and they know I'm not going to read every single word and measurement, so they just write stuff in. That only hurts you. Maybe you'll pass the ECG workout section because you completed all of it, but you won't be able to recognize those ECGs on quizzes, you won't be able to recognize them on exams, and you won't be able to recognize them in lab. So we find out pretty early who's doing the work and who's not doing the work. Now again, although as you're going through, you're going to see many hundreds of ECGs, you could be tempted to just shortcut it and say, I know the steps, but I know what this is, let me fill it in. The American Heart Association Provider Manual is another textbook. We're required to have you purchase that as part of the ACLS course, just like you had to do your PHTLS book. That book will have some assignment reading in it, but a note on ACLS, it's not really designed for EMS. It's designed for all critical care, so it includes hospital information, pre-hospital information, and it's also designed for somebody who's already taken their licensing class, I guess is one way to say it. So you'll find that it will have helpful information in it, but the details in the background of these disorders, the background of how these drugs work, is going to be limited. So those details will come from your A&P that you've reviewed in human systems and now reviewing this class, your pharmacology knowledge from last semester and the things you're reviewing this term. So it's a great resource, but it's not going to have all the background information you need. So if you're looking at the AHA ACLS manual and you see something in there that you don't quite understand, you're probably going to want to go back to the paramedic textbook and read the details you need to fix the gap that's missing if you didn't find it in some other place. Now, not required on this list, but another great resource for you is the American Heart Association's 2020 ECC handbook. Now you can get that as a printed little flip book, so it's about that big, it's got a spiral on top, or you can get it electronically. I don't require you to have that, but it will be a very helpful tool for your studying for both ACLS and PALS next semester, and I used it very frequently when I was in the field. So it's a great resource, has all the algorithms that you're going to find in your provider manual, just shrunken down in size, has a lot of other helpful things that are in it that are not in the ACLS provider manual, but again, it's a reference, so it doesn't have the reading that you need for the background of learning it the first time. So at some point this term it would help you, but if you get it later, that'd be fine. But keep on your radar that you might want to have the ECC handbook in addition to this as well. All right, these are the course outcomes that are listed in Brightspace in that first module. So let's breeze through those. We've got our attendance policy here. Make sure you review that. It is an updated attendance policy from last semester. A little bit different. Most of the nuts and bolts are there, but I'll let you review it. And then here's what we really need to know, right, for successful completion, the components that we need to pass this class. So again, with ACLS, just like PHTLS, you have some components you have to complete in lab and some components you have to complete in theory. And so the ACLS class is split between those two components. So the things that you have to do for ACLS for the syllabus don't talk about the whole ACLS experience. However, if you don't pass, say, the mega codes, which is part of the lab experience for ACLS, you won't be eligible for ACLS certification, so you won't pass this class either. So it's important you pass both of them, but that's just what we did, essentially exactly what we did in trauma and PHTLS. All right, so as always, number one, 70% or overall better or Number one, 70% or better overall academic grade in the class when everything's tallied up, and you have to make sure that you've passed the course finals cumulative 70% or better. So both of those things have to be true. Now the cumulative course final is actually broken into two major parts. That's why it's listed here as over 2 different days, but that overall exam grade needs to be 70%. You have to complete the Huffbook assignments, so if you don't complete it, you're not eligible to pass the class. Complete the ACLS course requirements, and then, as always, compliance with our handbook. Now, if you did, say, all of 1, 2, and 3, but you don't pass ACLS, then you'll receive a D for the class, regardless of what your overall percent grade is for the class, because it's not you didn't meet the requirement. Here's a list of all the things that need to get done for our grading. So this is what's inputted into our gradebook. The AHA-ACLS pre-course self-assessment is a pass-fail because it's a requirement for ACLS, so it doesn't have a big impact on your overall grade. All the quizzes together will make up 10% or 1-letter grade of your overall grade. The Huffbook is a pass-fail check, so you either submit it or you don't, and you have to complete all of the Huffbook and submit it to get credit or you don't pass the class, though it doesn't necessarily have directly an impact on your grade. However, again, if you half-ass the Huffbook, you're probably not going to recognize ECGs on quizzes and exams, so it will bring your grade down in the gradebook in those areas. Assignments are going to be your homework assignments. Those make up another letter grade of your overall grade. Remember to memorize the assignments after you've completed them to prepare for your exams, because the exams will have questions from all the assignments. You have 3 exams as our block exams, 1, 2, and 3, each worth 15% of your overall grade. We'll have a pharmacology exam that we take, which is essentially towards the end of the course. That's worth 1 letter grade, 10%. And then your final comprehensive exam is worth 25% of your overall class. Now, the AHA certificate in the theory course requires that you take the pre-test that you'll upload this week, and at the end of the term, the last week of class, you'll take a post-test. The post-test for AHA is not as weighted as a final, although it is comprehensive. It's not weighted as a final in our gradebook, because again, you have to pass so that you can meet the requirements of the course. And with AHA, similar to what we saw in PHCLS, the percentage for passing that exam is not 70%. AHA generally requires 84% or greater to pass their exams. The AHA written exam is going to be multiple choice with 50 questions that you'll complete, and you do have a remediation available to you if you do it in the appropriate time before the due date. All right, not a lot of changes to my policies on late work and so on. There's some statements on equipment and technology that can make your experience here at CNM helpful. That's new to our syllabus, so take a moment to review it. And then as we scroll down, we finish up with communications, certification requirements for ACLS. So this is the ACLS course. This is what's required to pass it as part of passing the class. And then the schedule is the separate document. All right, excellent. Good. Let me know if you have any questions about the syllabus. Do review it. Make sure you complete the syllabus acknowledgement before we get started for this week. The sooner, the better. So if you can do that today, that would be great. Okay. Now, finally, to look at the flow of some other components of class, I do want to talk about a few parts of this. So let's look at exam number 1. Most of the block exams that you've experienced so far have been exams that cover a block of information, but don't really go outside of that until we get to the final. In this course, we're going to find that exam 1 will cover modules 1 through 6, and of course, the modules before module 1 will help you get the resources you need to move into exam 1. But exam number 2, oh, it's hidden here because I'm on your view. But exam number 2 is comprehensive. So exam number 2 will have information on it that was on exam number 1 because they build upon each other. We're using very similar components, and patients have multiple rhythms and problems going on underlying. So be aware of that. Review in each exam section the components that you need, the resources you need, and make sure that you've got your Respondus Lockdown browser set, and you use the Respondus Lockdown browser practice test to make sure all the settings are appropriate before you take those exams as standard in previous classes. All right, so finally, I do want to talk a little bit about how you use these resources, okay? So again, the first few modules and background modules may not necessarily pertain to this, but once we start learning about ECGs around modules 5 and 6, you'll start using all of these things together, okay? I'll remind us when we get to those modules as well, and if you have questions about how to incorporate this into your studying, please schedule some office hours with me or just email me, but this is generally what I would expect you to do. When you sit down to work on a module for a particular topic, let's use atrial rhythms, you'll have your reading, you'll have your video, and so on that you'll have to put together, and that's all listed in your checklist. But the textbooks, the Huff book, and your treatment guidelines, I think just warrant another review of how to use them. So if it was me and I was sitting down, and let's say I'm looking at atrial rhythms, and we're looking at supraventricular tachycardias, right? Fast heart rates that occur, and they originate above the ventricles, so i.e. the atria. When I'm learning about that, because this class is not just an ECG interpretation class, I'm going to have to learn the pathophysiology that causes these rhythms, okay? The textbook's a great resource for that. The ACLS book gives you like an overview, and then if you need details, the paramedic textbook's a good resource. You'll learn that. You'll need to recognize the ECGs, so you'll be spending your time in the Huff book practicing ECG recognition for those types of rhythms. So you see all the different variations, you do all the different measurements, and you can get a very good grasp of the variety that atrial rhythms can present themselves in. As you're aware, no ECG looks exactly the same. Might have the same combination of waves and same patterns, but they all have different measurements. One person could have a rhythm today, and tomorrow that rhythm changed slightly, and that would be evident in the measurements that we do and assess in our ECG interpretation. So the Huff book helps you practice that. At the same time, though, we're learning what's the problem? What's the pathophysiology that causes this? Here's the ECG that I need to keep a lookout for. And then here's the patient's condition and treatment. The condition and treatment, you're going to be utilizing a mix of the ACLS provider manual and the cardiac treatment guidelines to memorize how to use this in lab. And although that does sound like a lot, to be fair, when you're in lab, you're putting all these pieces together, right? It might not be in the same order that I'm introducing it to you here, but when you're in lab or on a call, patient says, something's wrong with me. You investigate. Part of your assessment brings up an ECG. You interpret the ECG. You put all those pieces together and say, I think this is what's wrong with my patient. Now, what's the pathophysiology of that? It's this, this, and this. And what does that relate to treatment, and how do I treat my patient? This, this, and this. So we're spelling out to you the block of information you need to manage somebody with SVT by using these multiple resources, okay? So you want to have them develop your own system so that you can systematically kind of put these pieces together. But really, when you're finishing up a module, you should have completed all of those components and committed to memory those different resources so that you can extract this information to lab. All right, team, I hope that's helpful. I know this is a little bit of a long video, but in our first week, it's about orientation, get you kind of eased into the class a little bit. Some of you may have to do more review than others on A&P and so on, but at least now you have the context, you know what we're looking for, and we know what we want to use it for when we get to the point of the other modules where we start applying this information. If you have any questions, please reach out to me, let me know, schedule office hours, send me an email, whatever it is that I can do to help you, let me know, and I look forward to working with you this term. All right, everybody, stay safe.